pregnant sooner can become real after Wegovy, Semaglutide, or Zepbound, Tirzepatide, even when pregnancy seemed unlikely. Weight loss and improved insulin function may help restore ovulation, meaning egg release before periods look regular. Zepbound may also reduce oral birth control effectiveness during specific weeks. Fertility can change before goal weight, so review birth control or pregnancy timing when treatment begins, not after visible weight loss. Beyond the birth control issue, these drugs affect fertility indirectly rather than working like fertility injections. They reduce appetite, lower body weight, and improve insulin resistance, meaning the body needs less insulin to control blood sugar. That insulin change matters most when high insulin is disturbing ovarian hormones. It can push the ovaries to make more androgen hormones, which are usually higher in men. It can also interfere with normal egg development and release. This pattern is common in polycystic ovary syndrome. The condition can cause irregular periods, excess androgen hormones, and missed ovulation. When insulin levels and weight fall, those hormone disruptions may ease, allowing egg release to become more regular. These drugs do not directly make the ovaries more fertile, and they are not medicines designed to trigger egg release. Instead, improved weight and insulin control may remove barriers to normal ovulation. Pregnancy can then happen suddenly because ovulation occurs before the next menstrual period. A person can conceive without ever seeing the regular period expected as a warning. Direct fertility evidence for Wegovy and Zepbound remains limited. Most studies used older drugs in the same hormone family among women with polycystic ovary syndrome. Some trials reported more regular cycles or more pregnancies without fertility procedures. However, newer reviews say the evidence is uncertain and based on weak studies. These findings do not prove either brand directly increases fertility. The biggest practical change often appears in people with long, unpredictable cycles. Someone with polycystic ovary syndrome, insulin resistance, or recent skipped periods may move from rare ovulation to more frequent ovulation. Weight and insulin levels may improve together. The effect is less predictable when infertility has another main cause. Blocked fallopian tubes prevent sperm and egg from meeting. Having very few remaining eggs or severe sperm problems also requires separate evaluation, regardless of weight loss. No number of pounds or treatment weeks proves fertility has returned. Ovulation may improve during early weight loss, before the highest dose, or before cycles become easy to track. The calendar cannot replace contraception. Cycle history helps estimate who is most likely to regain ovulation unexpectedly. Someone who already ovulated monthly may see little fertility change. Someone with periods every 2 or 3 months may regain egg release quickly, even without a perfectly regular cycle. Period tracking apps cannot confirm that ovulation is absent. Their predictions are weakest when cycles are irregular or changing. Ovulation test strips can confuse people with polycystic ovary syndrome because hormone changes may cause repeated positive results without proving egg release. Being told you might be infertile is not birth control. Infertility means pregnancy is harder, not impossible. Once ovulation returns, pregnancy can happen before anyone realizes fertility has changed. Zepbound adds a separate contraception problem. It slows stomach emptying most strongly after the first dose and after dose increases. That can reduce how much birth control medicine is absorbed, so the prescribing information requires extra protection. People using an oral birth control pill should switch to a non-oral method or add condoms for 4 weeks. That rule applies after starting Zepbound and for 4 weeks after every dose increase. Dose increases often occur early in treatment, creating separate 4-week windows for backup protection. Mark each increase because the window restarts. Non-oral hormonal methods, such as an implant, injection, vaginal ring, or skin patch, do not depend on stomach absorption. An intrauterine device, a small device placed inside the uterus, also does not rely on stomach absorption. These methods avoid the absorption issue. Wegovy does not have the same warning about birth control pills. However, restored ovulation can still raise pregnancy chances. Vomiting or severe diarrhea can also interfere with some pills, so follow the pill's missed dose instructions when those symptoms occur. Neither drug should be used for weight loss during pregnancy. When you learn you are pregnant, stop the drug and contact the doctor who prescribed it. Animal studies raised concerns about harm to a developing baby, while human pregnancy data remain too limited to measure the risk. Taking one of these drugs before realizing you are pregnant does not prove that harm occurred. Record the last injection date and contact the doctor who prescribed it. Next steps depend on timing, other medicines, blood sugar, and overall pregnancy risks. Treatment side effects can also hide an early pregnancy. Nausea, fatigue, appetite changes, and a late period may be blamed on treatment. A pregnancy test is reasonable after a late period or recent unprotected sex. Testing can show whether pregnancy has already begun, but it cannot protect the rest of the cycle. A negative result today cannot prevent conception later. Reliable contraception or a planned medication stop remains more useful than repeated testing alone. The plan should begin with one question: whether pregnancy is unwanted, wanted later, or actively planned. That answer determines contraception, when to stop the drug, and the medical plan after treatment ends. Faster weight loss is not the deciding factor. When pregnancy is unwanted, use a dependable method before the first dose. With Zepbound and oral birth control, add condoms or change methods during every 4-week risk window. Do not wait for periods to become regular. If pregnancy is wanted later, continue reliable contraception and review the stop plan before trying. When pregnancy is planned within several months, create a transition plan early. Include the medication stop date, nutrition support, weight maintenance, and blood sugar treatment if diabetes is present. Stopping without a plan can cause hunger to return and weight to rebound. Wegovy should be stopped at least 2 months before a planned pregnancy because semaglutide remains in the body for weeks. The United States prescribing information gives that interval. Zepbound has no specific waiting period in its United States label, so set the stopping date with your doctor before trying to conceive. Planning ahead matters even more when diabetes is present. The A1C test shows average blood sugar over roughly 3 months. High blood sugar around the time pregnancy begins can increase risks, so another blood sugar treatment plan may be needed before stopping treatment. Before pregnancy care should include folic acid, plus a review of blood pressure, thyroid treatment, and every prescription or supplement. These steps reduce avoidable risks after the weight loss medication is stopped. Once someone starts trying to conceive, the priority becomes maintaining nutrition and entering pregnancy with a clear medical plan. Fertility evaluation should not be delayed when periods remain very irregular or a known fertility problem is already present. Otherwise, evaluation generally begins after 12 months of trying before age 35 or after 6 months at age 35 or older. People over 40 should seek advice sooner. Wegovy or Zepbound may make pregnancy happen sooner by restoring ovulation, especially after irregular cycles. Zepbound can also create temporary oral birth control risk. Match the medication plan to the pregnancy plan before either one changes unexpectedly. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.